Hello everyone, today we are going to learn about Excimer light therapy. So Excimer light therapy is slightly different from the Excimer laser. What I am holding in my hand is a handheld machine of Excimer light therapy. So what is Excimer? Basically it is a kind of targeted or focused phototherapy. What do you mean by targeted or focused phototherapy? That means the patient will receive the UV radiation only at the lesional site and not on the normal skin. Only the lesional area will be exposed to the UV radiation, while the rest of the non-involved area will be protected from the UV radiation. Now, depending upon the size of the lesion, you can put various filters. Various filters of various sizes are available along with the machine, and depending upon the size of the lesion, you can put the appropriate filter onto it. Excimer emits a monochromatic radiation of 308 nanometer, and it is being used in the treatment of vitiligo, psoriasis, eczemas, alopecia areata, predominantly for the treatment of vitiligo and psoriasis. We have to first determine the minimal erythema dose of the patient before giving the Excimer light therapy. For example, in Indian skin, the Indian skin type is usually type 4 or type 5. And the MED range, it usually varies from 150 millijoule per centimeter square till 400 millijoule per centimeter square. So what is minimal erythema dose? Minimal erythema dose is the minimal amount of the UV radiation which is required to induce a perceptible erythema at the site where we have exposed the patient to the UVB 24 to 48 hours after the irradiation has been done. Okay, so it is the minimal erythema or the perceptible erythema, minimal perceptible erythema which develops after the UV exposure in the patient, and it is there for 24 to 48 hours. So this is how we need to first understand what is the minimal erythema dose, and then we need to calculate the minimal erythema dose in the patient. So now we know what is minimal erythema dose. Now we need to explain it to the patient before performing the MED test onto the patient. So we need to tell the patient that you will be exposed to UV radiation and different doses of UV radiation will be given to you. You will just feel little bit of warmth. Usually burning is not experienced during the time when we are giving the UV radiation to the patient. The patient has to come back the next day after 24 hours so that we can determine that at what dose the patient started developing erythema. That is the minimum dose at which the patient started developing erythema. Also, we need to tell to the patient that because this is a testing dose, that we need to determine what is the minimum dose and what is the maximum dose that can be given to you. So, we need to perform this test. While performing this test, because of the higher doses, you might develop a sunburn kind of reaction. If you develop that kind of reaction, there is nothing to worry about. That will be taken care of after giving some medications. But if by chance that kind of reaction develops, you need not freak out and just approach to your dermatologist. So now what we are going to do, we are going to demonstrate how we are calculating the minimal erythema dose. I will be giving 6 shots over the forearm of the patient. You can also choose the side of the back. The patient needs to protect this area from any natural or artificial source of UV radiation. So predominantly we need to say that we need to avoid the sun exposure in such patients, and after 24 hours the patient needs to revert back so that we can calculate and we can find out what is the minimum dose or minimal erythema dose of the patient. Once we know what is the minimal erythema dose of the patient, we need to start the Excimer light therapy at 75% of the MED and then gradually increase the dosage of the Excimer light therapy. We have to give the therapy around 2 to 3 times in a week, and the days should not be consecutive. This therapy should be given on non-consecutive days, followed by sun exposure should be encouraged in those patients, and the patient can continue on the topical and oral medications if they are on any. Okay, so now let us learn how to calculate the MED in patients. Thank you. So now we have mark the patient's forearm we have divided this particular block into 6 further blocks, and we are going to give different dosage in each and every block. So I'm starting from 150 and then 200, 250, 300, 350, 400. So we have to give different dosages, and then the next day we will determine that at what dose, what minimum dose the patient developed an erythema. Now before doing this procedure, we need to inform the patient about the UV radiation that I have already told you. Make sure that both the doctor as well as the patient is wearing UV protection glasses to protect our eyes from the UV radiation. So I have set the dose on 150 millijoules per centimeter square, and I have put on my UV protection glasses. Very carefully I will put it on the spot. Okay. And start. You have to wait till the machine turns off. I mean, this sound should turn off. Okay. And now the second dose. Now I have increased the dose to 200 millijoules per centimeter square, and now I am going to put it in the second slot. Carefully put it on the slot and shoot. Now I have increased the dosage to 250 millijoules per centimeter square. And so on and so forth. You can increase the dosage and then determine the MED on the next. Yesterday we had learnt about how to give the test doses for calculating the minimal erythema dose, and today the patient has reverted back after 24 hours. Let us see where the patient has started developing erythema. The first dose where the patient developed the minimal perceptible erythema. So this is the 150 column. You can see that there is very mild erythema over here which is perceptible. You can see over here, this is the erythema. I hope that this thing is clear to you. You can see that the other parts of the forearm, they are not red, but this part is red where we had given the shot yesterday. So let us move on to the 201. It is more clear now. The erythema is better, can be seen in a better way. In the 250 column, now you can see a very clear erythema, right? So, but the minimal perceptible erythema had started from the 150 itself, from the 150 column itself. So, the minimal erythema dose of this patient is 150 millijoules per centimeter square, and we are going to start the sessions at a lower dose, 75% of the MED, and then gradually increase it to reach the 150 millijoule per centimeter square level and maintain on that dose. So I hope you found this video useful. Take care.